Hey, good afternoon. It's Dr. Chad here. Just wanted to give you a great video on just some research on chiropractic. There's some new research that just came out that we actually just posted to our Facebook page. But also here's some research from some of the most, I think, relevant research long-term for chiropractic is that, back in the 1930s, there was a medical doctor, Dr. Windsor, who had so many patients that went to this chiropractor in his community that came back to him and saying, hey, I used to have headaches or irritable bowel syndrome or migraine headaches, anxiety, asthma, all these different things, and people of all ages, kids to geriatric population. And they were like, well, I don't have this condition anymore. Can you retest me? Can you recheck my blood work? Whatever the studies would show that that person had a condition. And this doctor noticed that all these patients had been totally corrected. They've been totally healed of whatever condition they had had. And so it sparked an interest in him, this medical doctor, because he was like, well, chiropractic is only for two things, and we always talk about this, neck pain and back pain. The research that he did was like, okay, well, if there's a correlation here between the spine and the function of the body, well, what is it? Well, he opened up Gray's Anatomy, and one of the first pages in Gray's Anatomy says that the nervous system is the master control center of every system, every organ, and every cell in the body. So he actually studied cadavers, dead people. He looked at whatever that person died from. He traced the nerve from that organ back to the spine, and in 100% of the cases, he studied 200 cadavers. 100% of the cases, there was a direct correlation between the nerve that went to that organ, that the death of that organ or the cause of that person's death in the organ was traced back to the spine. 100% of the time, there was severe degeneration of the disc, severe nerve pressure, and wasting away, what's called atrophy of the nerve. So the longer there's pressure on a nerve, you may not feel the symptom initially, but over time, that nerve gets pressured and shrinks. And the more that it has compression, the less signals that it sends along that nerve. Over the course of decades, that creates disease. And the longer you have a disease, the more higher risk you're going to have of death. So the Windsor autopsy studies were phenomenal. There are other studies with HIV patients that, especially right now in the COVID crisis, that immune system, big deal. We looked at, over the course of 6 months, patients that got a real chiropractic adjustment versus a sham chiropractic adjustment. They looked at their T cells, which are your main viral immune cells, that there was a 400% increase in the numbers of T cells in the bloodstream with those people that were getting adjusted versus the people that were not getting adjusted. So one of the key aspects of that study showed that chiropractic adjustments actually raise the level of your immune system's reaction to infection. So right now it's a huge study. And the most recent one that was just posted on Facebook here was a study of blood pressure and anxiety. So if you didn't know this, blood pressure and anxiety is always going to stem from somewhere in your mid-back, those thoracic regions. And the study showed that nerve pressure in the mid-back and the ribs and the compression that's there actually creates extra stress on your heart and on your lungs. So no surprise there. If you look at any nerve chart, you're going to see the nerves in the mid-back go to the heart, go to the lungs, and what is anxiety or what is high blood pressure, all that's going to be coming from our thoracic cavity. So the studies showed that over the course of time with adjustments, the levels of blood pressure had been drastically reduced. The numbers were 15 to 30 points lower on the systolic and the diastolic, so the top number and the bottom number. And then the anxiety was significantly reduced, up to 50 to 60% reduction in that feeling of anxiety or anxiousness. So the key to all of this research is to say that we as chiropractors could never say, hey, we can cure this or cure that. The FDA is very strict on saying, hey, the only thing that can cure or treat or correct anything is drugs or surgery. But we know through our history with the people that we have seen, the things that people have overcome. We have patients that have overcome MS, fibromyalgia, severe neurological things like that, that you would never think that an adjustment would help with. But time and time again, when the body has significant stress released off of the nervous system does what it does best. And what is that? It heals. It adapts to all the stress and the issues that we have. And there's never been a more stressful time than right now. We're in the middle of an election. We're in the middle of still COVID, second, third wave, whatever you want to discuss about that. The stress is just constantly squeezing and creating all this extra unnecessary pressure on our body, and over the course of time that creates disease, and that over the course of time leads to an increased higher risk of death. So there's not one thing out there that isn't linked, as far as disease or death, that isn't related in some fashion to chronic stress. And we have to be diligent and vigilant about dealing with our stress. Chiropractic isn't the only thing that is going to help with that, but it is a critical aspect of dealing with stress, because its only focus, my only focus when I give you an adjustment, is to release the power in the nervous system, because then that stress, once that stress is released, your body can actually overcome and heal exactly the way God created it to. So I hope this video helps. Some of the research that actually backs up what chiropractic has been saying for over 120 years is that direct pressure on the nerve creates an inability for the body to adapt. And the inability of the body to adapt over time creates the disease. So if we reverse that process, taking the stress off the nerve, then your body can adapt and live potentially to the life that you should, which is research is showing from Harvard to 110 years. Now, we may not want to live that long, but stress, if not dealt with, creates any and every health concern that you can imagine. And so our office is a safe haven. It's a safe place for so many people, because they've realized I have found freedom, I have found release in the stress in my body, and therefore my body can adapt and heal way better. So hopefully pay attention to more videos, comment, like on this video, share this video if you have family members or friends that desperately need to try chiropractic, because it's one of the most life-changing, powerful applications to health that you can possibly use. We're so grateful for all of you to follow us and thank us and trusting us with your health. Look forward to seeing you soon.